Sorry, I am really quite anxious about this. I think most of us who won didn't actually expect to win. So you prepare it, oh, yeah, quick look on the train. And, ooh. So apologies if I'm a little bit all over the place. Oh no, wrong one. Okay, so I come from outpatient physiotherapy background, and I'm talking about our journey from being a very challenged team, and challenged is a polite word to use how we were, to what we now consider to be a really great team, actually. So traditionally, I think MSK physiotherapy has struggled to gain feedback from patients, but also to get good feedback. We, as a group of service providers, tend to have quite a lot of problems. We have a lot of waiting lists generally across the country, and the journey that we've been through as a team, I think, is reflective of what a lot of other services have either been through or are going through or will go through in the future in terms of trying to get good patient feedback and really good patient experience. So when I joined the team, we were on 60% friends and family test score. That's not dreadful, but actually we were a block contract service, so 4 out of 10 patients who had to use our service because there was no choice would not recommend us, were unhappy with the service we were providing. So we went out, we did lots and lots of patient engagement about what the problems were. This was a really big thing for us. We were based at a site that was really, really unsuitable, and on average people were taking about 40 minutes to get onto the hospital to actually get to their appointment. So they were turning up and they were peeved, and then really, really peeved when we were going, actually, we can't see you because we're running late, because actually the person that came last week realised it takes 40 minutes, left 40 minutes earlier. So we were just in this constant cycle, and people were turning up and they were really annoyed, they were really angry with our physios. And actually, it doesn't matter how good you are, if you turn up and you're all wound up, it was very hard to break that down. So big thing we did, we moved site. We actually just cut our losses at the site we were at, and we moved to a new purpose-built building on a business park, which is actually good road links, close to the motorway, main road through Medway towns, and also excellent public transport. So actually, hardly any of our patients are late now. We also had a real problem with parking. Parking is something that annoys so many departments, and staff parking and patient parking, and the minimum cost was £2 for an hour. If we were running late, people were running up to the £4, and actually with physio, you're coming 6-7 times, maybe a couple of times a week. A lot of our patients were on benefits. There was no difference for disabled parking, so it was a real issue. We've now got free parking at every single site we work out of, and that is brilliant, and that's for staff as well. It's a slight exaggeration, but not much. The department was built in the 1980s for a temporary solution. We were there in 2014. So it was grubby, we were failing infection control, our environment audits were bad, and it just looked horrible. If you go in somewhere that looks horrible, everyone was like, it's horrible. They were lying on the couch, head through the floor, and the floor was lifted, and it was, and there were stains, and it just was horrible. So again, big thing, we obviously moved. We made sure it was fresh, clean. We invested in a lot of new equipment, and we make sure that we employ our own cleaners. So they're as much a part of our organisation as the physios, as the nurses, as the doctors. They're actually a member of our staff. They're shareholders, so they're proud of what they're doing. So that's really improved things a lot. Traditionally, MSK physio, it's the waiting list. That's what you always hear. You hear it across the nation. And at one point we were 23 weeks for a routine appointment and 6 weeks for an urgent appointment. So if you came out of a plaster, you waited 6 weeks to see someone, at which point your outcomes weren't going to be as good. And again, you were turning up and you were irritated. We've worked really, really hard on our waiting list. That took about 18 months to get that down. We did lots of different things. We've done loads of capacity work. We've worked very collaboratively with our CCG, which actually has been quite refreshing. We really went to them with, this is how many patients we've got. This is what we can do. We can do A, B, and C to streamline stuff, but actually, if you want a good quality service, we need to be talking some investment. So actually, the CCG did invest, but also our organisation decided to match fund that, so that actually we were very collaborative in what we were doing. The clinicians, really the credit sits with them. They absolutely worked their tushies off. They did blitz clinics, which for those of you who don't know what that is, that's where you have new patients all day. It's horrid. Literally, they're back to back. We overbook by about 30% because you're hoping that people don't turn up. And generally they do. You work it through lunch. The one thing we did do to help them, though, we bought them pizza from Domino's. That absolutely won them over because they were so starving and they were so tired. They were like, oh, they fell on that Texas barbecue at lunchtime. So that was really good. But overall now we're in a really healthy position. We're at 2 weeks for all our appointments, and actually urgent appointments we could probably see you tomorrow, which is great. Now any delays we have, it's because patients are going, oh, I didn't think I'd get seen that quickly. Oh, I'm going on holiday. Oh, so it's, so we're in a much, much better shape. Access to the service wasn't just about the roads and the parking. Our phone system was woeful. When we put the phone system in, it was to cope with about 4,000 patients. By the end of it, because of the inevitable merges and let's make efficiencies, that phone system was coping with about 36,000 phone calls a year, and it just couldn't deal with it. The staff couldn't deal with it. And then of course people go, I couldn't get through, and they're being shouted at, and then the attitude of the staff changes, and it was just all horrible. And we also didn't do any extended hours, which in this day and age is not really acceptable at all. So we've moved admin. They've now got a proper call centre system, which is working really well. Patients get feedback, you're number 5 in the queue, so at least they know how long they're going to wait, so that's been a lot better. And also we now do lots of early mornings, lots of evenings, and lots of Saturdays. And actually the staff are quite happy to do that because we flex their hours. So we're not saying you have to work Saturday mornings, we're saying, does anyone want to? Does anyone want to do evenings? Actually, who fancies doing a 4-day week? And loads of people going, I'd love to have Wednesday off. That'd be great. So we've managed to do it that the patients are getting what they need, but also the staff are really happy with that as well. We've done a lot of investment in clinical skill. Obviously, that's really important, keeping the department up to scratch, really, really fresh. All our band 6s and above are trained in acupuncture. We have extra Pilates classes. We do absolutely tons of stuff. That's kept the staff retention much higher because they feel as though they're getting invested in and they're interested in what they're doing. But also patients are getting a really, really good service. We've done a lot of work around our women's health service. That traditionally is like a very small part of outpatients, but actually is really quite important and makes a lot of difference to certainly women's lives in managing their continence and gynae problems and stuff like that. We are now actually extending that out to men's health following feedback generally from people's wives. I have to say that the patients are coming in for their problems and going, actually, my husband and da-di-da. So that's been really, really successful. And actually all the stuff we've done has really paid off. So over the years that I've been with the team, the Friends and Family score has generally improved year on year. Last year the overall was 98.41, which is really, really good. But generally I would say month on month we're approaching 100% now. So, it's really, really good. And the other thing I didn't say is we were getting 3 to 4 complaints a week. Formal complaints, need a load of letters, very time consuming. We now get about 5 a year. So it's completely different. It's a completely different environment to work in. So, we're not 100% there. I don't think anyone could be 100% there. We strive all the time to provide good patient experiences, and, we've certainly got happy staff. Overall, the patients are a lot happier, but it's just about continuing to work. We've got lots of plans about how we can continue to develop. Very much flexible workforce, keep going with that capacity work, keep that communication open with the CCG. They've been very responsive. We're readopting hydrotherapy because we had to lose that for a while, but we're now dipping our toe back into that, as they say. And we're also extending out to sort of men's health. So we're trying to create a very equitable service across the board. And that's it. And I'm 1 minute spare. Woo!